Welcome to the second part of Chapter 5, Biomechanics. We are continuing our conversation on articulations, joints, as we proceed towards muscles. We've already covered skeleton in the previous weeks. I know you are huddled down right now in Greensboro during the snowstorm, and if you're somewhere else safe, warm, congrats, you win. For those of you who were worried we wouldn't have a lecture, you're welcome. This is what we're doing. We've already talked about articular cartilage. It's made up of connective tissue. Hyaline cartilage is the most common in the body. That's going to line both edges of a diarthrodial synovial joint. So we line those joints. That cartilage will help produce synovial fluid, and the capsule, of course, keeps that synovial fluid inside the joint. The function, as we talked about before in class, is to disperse stress. The articular cartilage disperses stress. It reduces friction and wear, thus promoting the quality function of the joint. It is soft, porous, permeable. It is just like a sponge. We talked about how motion is required for the synovial fluid to move and to compress into the hyaline cartilage. And we talked about the friction of that synovial lining, the synovial joint. The articular cartilage is about 1/4 that of a skate on ice. Very slippery, very smooth. Articular fibrocartilage. Vertebral discs. You might also be thinking of meniscus in the knee, the menisci. The menisci are a partial disc, kind of a semi-lunar shape. Sort of when the moon is not in full phase, it's semi-lunar. There are discs at every level of the spine except between the occiput and C1 and C1 and C2. Every other level has a disc, and that is made up of fibrocartilage. It's much more dense than cartilage. It's much thicker. It's a unit unto itself. The function of the discs is to distribute loads, to transduce loads. It is absolutely not to absorb loads. That is very important. I will repeat that during the semester. Do not confuse. Discs are not shock absorbers. That is a common misunderstanding. They are used to translate transduced force up the spine. The ground reactive forces must disperse throughout the entire body. The osseous structure, the skeleton, is much better at absorbing forces than the discs themselves. Make sure you remember that. Distribute loads is a primary reason for a disc or a meniscus. In the case of a meniscus, we again are talking about dispersing stress throughout the joint. Number 2, improve fit. The meniscus especially helps create an improved fit between the femoral condyle coming down and the tibial plateau meeting from underneath. That should kind of make sense. It just fills in the space in between. Limitation of slip, that's a variation on improved fit. The limitation of slipping, the limitation of the femoral condyle to slip away from the tibial plateau is certainly benefit of the meniscus. The vertebral disc as well is limiting slip. Number 4, protection. Any sort of force from in the frontal plane to the knee, forces posterior to the spine. The disc will help protect that joint. It helps add another dense structure, a fibrocartilage structure to that joint. 5th, lubrication. The disc aids in a surface to spread synovial fluid across and lubricate the joint. Synovial fluid is at its base a water-based solution, so it's going to help spread that fluid all through the joint and stay lubricated. 6, shock absorption is what your book will say. I want you to remove that from the answer. I don't agree with that. I don't think the science backs that up. But I do want to point out that your book argues that articular fibrocartilage will absorb shock. In fact, it will transduce shock. It will send shock somewhere else. We'll pause and come back in one moment.